Hello, and you're watching TV9 News and I'm your host Deepak. You probably know what everybody is talking about in the last couple of days. It's everywhere. Your newspapers, TV channels and debates on social media too. On July 20th, the Union Health Ministry's written reply to the Rajya Sabha sparked a bitter debate about the veracity of the centre's claim. International media also took notice of this particular row. The reply said that India hadn't witnessed a single death due to oxygen shortage. Now, there are victims out there who still believe that their loved ones died due to a paucity of oxygen. There are videos on social media that show people dying without adequate supply of oxygen. But what do the experts of the medical field believe? Do they agree with the centre? Let's find out that from Dr. Sitesh Roy, an immunologist from Mumbai. Firstly, doctor, what do you say about the centre's claim on no deaths due to lack of oxygen?
Deepak, I really believe that it is a matter of semantics how we look at the entire situation, because there was shortage of oxygen. That is a definite reality. We have seen the prices of oxygen rising dramatically during the second wave at its peak. We have seen people running from pillar to post to get oxygen concentrators or home oxygen cylinders. And there is no doubt in my mind that given that COVID-19 pneumonia causes hypoxia, and whether it's happy hypoxia or distressful hypoxia, that was a mediator to a lot of deaths. There is no doubt in my mind about that.
Now, we've had case studies like in Chamarajanagar where 24 people died in just one day due to a lack of oxygen supply. Isn't this a clear case that gives lie to the centre's claim?
As mentioned, certainly there have been shortages of oxygen during the peak in various parts of the country. And we know this from all the NGOs and other organizations that were trying to get oxygen concentrators and oxygen cylinders and helping people out who were in need of oxygen. And with the lack and shortage of beds, which was really the issue, because there were more patients than there were beds available with oxygen supply. And hence many of these patients were waiting in order to get their treatment. And so I feel that there is some kind of a disconnect between what really happened and what is being said right now.
Okay, doctor, for the people to understand now, please tell us how a patient dies due to oxygen shortage.
COVID deaths due to hypoxia. Hypoxia means low oxygen levels. Oxygen levels that are in the 80s might be tolerated by a human being. But once the oxygen level drops into the 70s, 60s and 50s, end organ damage, especially to the brain, to the kidneys, to the heart, are very, very common. And under such situation, it is what is called hypoxic ischemic death that occurs due to lack of oxygen to the tissues that need a basic amount of oxygen to function naturally and normally. And this can be within minutes, hours or days, depending on the nature of the disease and the chronicity of the problem, as well as the underlying diseases of the individual.
Now, why wasn't the reason for death not recorded across different states as death due to oxygen shortage?
On a death certificate, the death is never written as shortage of oxygen. It would be written as a hypoxic cardiopulmonary arrest, or it would be written as a cardiopulmonary arrest, or as a stroke, or whatever the end reason was by which the person lost their life. The cause of that, which is hypoxia or low oxygen or shortage of oxygen, would generally not be documented in these reports, and hence there may be a discrepancy in the final analysis that is being seen right now. Cause of that.
Well, Dr. Sitesh Roy believes that oxygen shortage indeed led to the deaths of many COVID-19 patients. The virus attacks the respiratory system, leading to pneumonia, and then other complications follow, leading to the death of an individual. So the centre's claim, no death due to oxygen shortage, is not convincing at all. Now, if you've liked this video content, please do share it with your friends and family, and do not forget to give us a thumbs up. In the meanwhile, like, share and subscribe to TV9 News on all social media platforms. Thank you for watching and stay safe.